Welcome to CardioCare Live. I'm your host, Dr. Keith C. Ferdinand. We're going to be talking to Dr. Larry Kaskel. He's board certified in internal medicine and clinical lipidology. He's from Chicagoland. He's going to be discussing improved patient outcomes and enhanced revenue with therapeutic lifestyle changes, how to make these changes practical in your everyday practice. He can be heard every day on Lipid Luminations on ReachMD XM160. How you doing, Larry?
Good, Keith. Thanks for having me.
Okay, what do you have?
Well, I'd like to talk a little bit about how to actually make therapeutic lifestyle change work in a primary care office, make it work for your patients, and make it work for your practice to be profitable and help the bottom line of the practice. We are in very difficult times. There's a lot of economic dislocation going on, and first-line therapy allows practitioners to really use this program and benefit their patients and their practice. And so if we start with an old ancient proverb that says a good physician treats disease, a better physician cures disease, but the best physician prevents disease, I would say for the first 18 years of my practice, I was a pretty good physician. And at times I was a better physician. I was able to cure certain diseases. But over the last 6 months, since I became involved with therapeutic lifestyle change, I feel I have become the best physician I can by actually preventing disease. And I'm going to tell you how you can also go about doing that. Let's do a little background. The evidence in terms of therapeutic lifestyle change is quite clear. There's really no controversy or debate that currently exists. It works. It works very well. There are numerous papers and publications that show if you incorporate a low glycemic index diet with your patient, it is better than using a low-fat diet. You will improve all the parameters that you want to improve with patients with diabetes and the metabolic syndrome. You will improve their insulin sensitivity. You will decrease their insulin resistance, decrease triglycerides, improve HDL, lower LDL, lower small dense LDL, pretty much improve the entire atherogenic triad that exists in this condition. So if you look at other studies, they say you can't teach an old dog new tricks, but this study, actually the HALE project, looked at patients between the ages of 70 and 90. And by instituting a Mediterranean lifestyle diet in this population, they were able to decrease all-cause mortality by 50%. Pretty strong result and better than most medicines on the market that I'm aware of. If you compare all the diets, Ornish, DASH, TLC, ADA, AHA, pretty much if you take the Mediterranean, it seems to be the most impressive at doing what you want to do with your patients. Again, decreasing their waist size, getting rid of fatty liver, increasing the insulin sensitivity, decreasing the production of new fat, of triglycerides, creating an anti-inflammatory state in the body, and again, improving all the lipid parameters that you could possibly think of, lowering cholesterol, lowering LDL, lowering triglycerides, raising HDL, and again, lowering small dense LDL particles. And as recently as 2008, a journal article in the New England Journal of Medicine looked at comparing the three types of diets, low-fat, low-carbohydrate, and Mediterranean diet. It was a 2-year trial, looked at 322 patients, and if you look at this graph, you can see on the bottom is the low-carbohydrate group in blue, in the middle in yellow-orange is the Mediterranean diet, and on the top is the low-fat diet. You can see after a year or 2 years, pretty much the low carbohydrate and the Mediterranean diet seem to look far superior than a low-fat diet. And I think we've learned from the Women's Health Initiative that low-fat diets really do not work. And it appears that low carbohydrates, low glycemic index, low glycemic load diets, and combinations of Mediterranean diet are far superior in terms of, this is just looking at weight loss. And if we look at all the other parameters, you'll see that HDL rises better than in a low-fat diet. You'll see triglycerides go lower than in a low-fat diet. So a lot of this is counterintuitive. We've been taught for many years that low-fat diet, low-cholesterol diet, that'll improve all your parameters. It doesn't work. The patients are still coming back, and their lipids are really not affected in a positive manner. When you start putting them on a different type of food plan, such as low glycemic foods and a Mediterranean-like diet, you will see their lipid parameters improve dramatically and in the right direction. And so the conclusion made by these authors was that the Mediterranean or low-carbohydrate diets may be effective alternatives. I'd like to take it one step further and get rid of the word may. I think they are effective alternatives, and I think they should be first-line therapy and not alternatives to low-fat diet, which I have not seen to be proven effective in clinical trials and or in my own practice. So using therapeutic lifestyle change and a Mediterranean-like diet affects more than just lipids. It has effects on your entire body. When you reduce high fructose corn syrup from your diet, you can see blood pressure drop pretty much within 2 weeks. There's a concept known as fructose-induced hypertension, which most people are not aware of, and that responds to getting rid of high fructose corn syrup. Blood pressure normalizes. Your weight will normalize. Diabetes, you can not only control it, you can cure diabetes with first-line therapy and therapeutic lifestyle change. You create a anti-inflammatory instead of a pro-inflammatory state by eating foods that are lower in arachidonic acid, and so you're going down a different pathway, and you're having foods rich in omega-3s instead of omega-6s. You are affecting endothelial dysfunction, which some say is the ultimate risk factor of risk factors for heart disease. And again, you're improving insulin sensitivity. We're looking at a Google map of the island of Crete, and this is where it all kind of came from. The Mediterranean diet was really looking at people living in Crete in the 1950s. They lived very different lives than we do in 2009. Their diets were rich in olive oil, rich in fish. They ate a lot of fresh foods, fresh, non-prepared, non-enriched, non-shipped foods. These were fresh vegetables, fresh fruits grown there. The original whole foods, organic foods, non-processed, non-refined foods. They also ate less frequently. They didn't eat as much. They did not gorge themselves as we do in America. As members of Greek Orthodoxy, they had certain fasting days, so that contributed to less caloric intake. And again, they ate a lot of fresh vegetables, which are rich in omega-3s. And they walked. They didn't drive to the store to get their food. They walked every day to the local market. And if you look at the air in Greece, back then it was gorgeous, it was clear, it was not polluted, and their water supplies were also clean. So the Mediterranean diet is based on that. Obviously, we cannot recreate the air quality and the ground quality, but we can choose to eat fresh vegetables and fresh foods that have not been tainted by the industrialization of the American food supply. Margaret Mead said it's much easier for a man to change his religion than it is to change his diet. I think any physician knows that. It's very difficult to control human behavior. Our future, as you know, is fat. It is getting fatter. There are more and more cases of diabetes, metabolic syndrome every day. Our children are getting fatter, and the costs to society are enormous. This slide just goes through some of the billions of dollars that are spent just in diabetes. And if the government wanted to bail out the healthcare system, really all we'd have to do is try and work on this one disease, and I think we could make an enormous impact on our society. And government is actually paying attention. Metagenics actually presented in front of a Senate hearing committee last week talking about how to improve healthcare delivery in our country and try to work on therapeutic lifestyle change as a way to prevent illness instead of just dealing with the enormous costs that arise by treating it. We need to invest in a culture of health. We need to be as aware of, if you're sitting in a cafeteria where you work and someone lights up a cigarette, immediately that person is ostracized, demonized, dragged out of the cafeteria. We need to do the same thing when that person reaches for a donut. We have to jump on that person and try and make everybody in this society aware of the risks of eating poorly. So who made this opportunity possible? I'd like to thank the manufacturers of high fructose corn syrup. Those are Archer Daniel Midland and Cargill. I'd like to thank the purveyors or the distributors of high fructose corn syrup, which are pretty much everyone else you see in the slide. You can thank your local grocer for selling you very high caloric, dense foods that are not very rich in phytochemicals. And you may ask, who was Earl Butz? Earl Butz was in our government in the, it was either the 50s or the 60s or 70s, and he was involved in subsidizing corn. And because we have subsidized corn in this country, it has become so cheap, there's so much of it, that those two first companies decided we need to find another product to make out of this corn, and lo and behold, they invented high fructose corn syrup, and that has contributed enormously to the epidemic of obesity, metabolic syndrome, and chronic diseases in this country in the last 30 years. You can also thank physicians who are really just kind of not aware of this epidemic and are still just kind of focusing on cholesterol and healthy foods, healthy heart foods. You know, the American Heart Association has endorsed Cocoa Puffs and Count Dracula as heart healthy. I do not understand that. I do not see how those foods can be considered heart healthy, but because they are low in saturated fat, and that seems to be all we care about is fat. We've been misled that just avoiding fat we will be fine, but it is not true. I believe it is really carbohydrates and specifically high fructose corn syrup that has made this possible for all of us. The providers, the nurse practitioners and PAs are enjoying doing TLC because they are seeing dramatic responses from their patients, and they're able to withdraw medicines from their patients. We have cured diabetics, we have cured metabolic syndrome, we have cured hypertension. In 6 months, we've been able to trim our patients of numerous meds, saving them thousands of dollars, saving their insurance company thousands of dollars, and the patients feel great. In summary, if you implement first-line therapy and therapeutic lifestyle change in your practice, you will see a very rapid transformation in your patients' lives, their waist sizes, and you will transform your own practice. And that's the end of the formal presentation. Thank you.
Thank you very much, Larry. Those of you who just come on, we've been talking to Larry Kaskel. He is a specialist in metagenics. He deals with nutrition and lifestyle treatment for his patients. And he's going to answer a few questions. Feel free to use the web-based system. You can visit Metagenics at the booth and the other booths also. And we will have another show at 4 p.m. with Dr. Bob Eccles. We have some questions. One of the first ones is interesting. And I didn't hear you talk much about exercise. This question goes straight to exercise. How much exercise should be recommended to a young person, they put in parentheses, late 20s, early 30s, and would the same person in the late 50s benefit from Metagenics?
So I think the answer for both age groups is the same. I recommend 30 minutes of activity, aerobic activity, every day of the week. Some of the national guidelines recommend 150 minutes a week. So I think the same is good for a 20-year-old as it is for a 50-year-old. I think that no matter how old you are, you will benefit from first-line therapy if you are eating a typical Western diet.
You know, it's interesting. We've talked over the phone before, and you mentioned the Mediterranean diet and the benefits of it, but if you go to the Mediterranean countries,
right,
they're changing. You're getting type 2 diabetes and obesity there. So how do you explain that?
Very easily. America is very good at exporting toxic products to the rest of the world. As we know from our subprime mortgage mess, we have exported that successfully and infected the entire world. We have also become very good at exporting our food supplies, which are fast foods, which are nutrient depleted and enriched with high fructose corn syrup. So I think as the rest of the world adopts our diet, they are adopting our diseases, which come from our poor diets. So it's unfortunate that we are destroying these pristine, beautiful civilizations or societies that had it right by them trying to adopt our lifestyle, which is not a good lifestyle.
You mentioned high fructose corn syrup.
Yes.
How is that different from glucose in terms of being deleterious? And I guess you would also say eating too much glucose is not the way to go. But why do you tease that out from glucose?
Well, the body handles fructose from high fructose corn syrup a little differently than it just handles glucose. The regular glucose gets absorbed into the bloodstream from the small intestine and gets taken up by muscles, gets taken up by the liver. But fructose is interesting in that it's kind of like a stealth bomber. It sneaks its way from the small intestine directly to the liver. And it gets to the liver, and the liver is flooded with fructose. And what the liver does is it turns that fructose into fat, triglycerides, starts pumping out triglycerides to the rest of the body. And so everyone's focusing on serum glucose levels, but they're forgetting about looking at the liver. And so in our children now, I interviewed a pediatric gastroenterologist last week on the show. She is seeing enormous amounts of children with fatty liver disease. And these kids already have non-alcoholic liver disease from fatty infiltration from excess fructose. And 10% of these kids are going to move on to become cirrhotic. And so the fructose in the high fructose corn syrup behaves differently in the body because it goes right into the liver, and the liver is just overwhelmed by it. And that's why we're missing the boat by just focusing on serum glucose levels. Because in sucrose gets broken up into a molecule of fructose and glucose, and so it doesn't really have a very large glycemic index, but we're forgetting about the effects on the liver by focusing so much on just looking at blood serum.
You know, you talk about soft drinks, but natural fruit juices, even if the person is drinking a natural fruit juice, doesn't that have high amounts of carbohydrates in it also?
It does. The fructose that you get from fruit is a little different than high fructose corn syrup in that the molecules are pure fructose. The molecules in high fructose corn syrup are not pure fructose. They're tainted with some other things that can actually create AGEs, which are things that sugars bind to proteins and bind to things that they shouldn't bind to, advanced glycated end products. And so in fruit juice, if you are concentrating the fruit juice and you're taking it away from the natural fruit, you're losing the fiber that was in that fruit that slows down the absorption of the sugar. And so when you are concentrating the fructose, and a lot of fruit juices, they are adding sugar to it and adding high fructose corn syrup to it. So in moderation, fruit juice, healthy fruit juice from normal fruit, juicing that would be okay, but the fruit juices our kids are drinking are enhanced with even more sugar.
Wow. You know, I had mentioned to you also when we were discussing in preparation for the program that certain patient populations may have a problem. And here's a question here. It says, what about the cost to the patient? It would be a difficulty in my patient population. Is that a point?
That's a good point. You know, when you decide to do therapeutic lifestyle change, you're making a choice to eat differently. You are choosing foods that are real food, and real food costs more money. The reason that if you go into a grocery store and you only shop in the perimeter of that grocery store and buy all the healthy foods, the dairy products, the vegetables, it's much more expensive than concentrating buying food in the center of the store, which is nutrient-dense, caloric-dense foods that are much cheaper. So the food supply in America has become very cheap, but it is also extremely deficient in nutrients. And so it does cost more money to eat healthier. Most other countries spend more money on food than Americans do. And so, yes, it is difficult to institute in a poorer population, but you can still educate that population different choices to make and teach them to avoid certain foods that are not good for them.
Here's a question, and someone gives you a shout out. They say, I applaud your honesty and frank forward talk about acknowledging the 800-pound gorilla in the room. What will we need to do to initiate healthcare reform to implement this TLC approach? I know you're not a politician, but what do you think we can do to get TLC into the healthcare system?
Well, I think it's happening. I mentioned in the talk that one of the physicians from Metagenics did speak with the Senate subcommittee last week, and I think the government is looking at therapeutic lifestyle change in a way to actually make an impact on diabetes and obesity in this country. But I also think, to be frank, again, is that our government may want to look at stopping subsidizing corn, because that's what got us into this mess. When you make corn so cheap and you make high fructose corn syrup so cheap, it gets into everything. And so they would have to start regulating manufacturers, and trans fats was not the problem. It would have been much better for this society to go after high fructose corn syrup, and you'd see a decrease in diabetes and metabolic syndrome.
Time is running a little short. We have about 2 more questions.
Sure.
One of the questions is related to the omega-6 versus omega-3, and I think you mentioned it in passing, the difference. Can you just briefly tell us that again?
I'd be happy to. Each cell in our body has a membrane, and that membrane is made up of cholesterol and fatty acids, and there should be a normal ratio between omega-3 and omega-6 fatty acids. Some say that ratio should be 1:1, some say it should be 1:5. In our society, in America, the ratio is so skewed in the wrong direction that we have way too many omega-6 fatty acids compared to omega-3 fatty acids, and that is because our food supply is full of omega-6s. And where do you get omega-6s? You get it from feeding our cows and our chickens corn. If you feed your cow grass the way it should be fed, the meat and the fat in that meat turns into omega-3 fatty acids. We are feeding our fish now. Farm-raised fish is now not good for you because they're feeding it corn. And so you're getting omega-6s from what you think is supposed to be healthy from eating fish, but you need to eat wild fish to get the omega-3s. And so the ratio in our cells is so skewed, and the way to offset that in this program is by introducing foods that are rich in omega-3s and also supplementing with fish oil.
Real short question. What doses of coenzyme Q10 and EPA-DHA do you recommend?
I start everybody on 100 milligrams of CoQ10, and I, in my practice, am starting everybody on 2,000 milligrams of omega-3s. And you need to really look at which omega-3 you're using and the product, because they have all sorts of ingredients in them.
Okay. We're closing. Maybe you can give us a take-home point, something that you think is really important for the audience to remember.
I'd be happy to. Therapeutic lifestyle change has been touted and been recommended to us as physicians for 20 years. We have never known what to do with that information. I did not know what to do with it. Finally, there is a program, First Line Therapy. Metagenics offers it. It is a turnkey operation that allows you to do it in your practice. You can change your patients' lives. You can get them off their medicines. They will feel better. You will feel better as a physician, and you will help solve the crisis we find ourselves in.
Thank you. We've been talking to Dr. Larry Kaskel. He's done a wonderful job showing us how we can do TLC in our practice for our benefit and our patients' benefit. We'll be back at 4 p.m. with Bob Eccles with another live show.